We jump in.
This is for you.
We are now recording and we're going to go ahead and jump in. Again, welcome to our all member call or our all business call today. We are thrilled to have you join us. We are excited for the conversation, especially to get the update from Kevin Unger with UC Health, but as well from Tom Gonzales with Larimer County Public Health and Environment. Lots of change has occurred over the last several days, and I'm hopeful that Tom might be able to acknowledge a little bit of that, but really our focus today is vaccines and the importance of them to our business community, the importance to our success and our recovery here in Northern Colorado. Let me first of all turn it over to Kevin Unger to share a few comments and observations, what they're seeing from a health system perspective. Go ahead, Kevin.
Well, thanks, Ann, and I appreciate you pulling this together, and thanks for including me. And before I kick off, I do want to say thank you to Tom Gonzales. It's been terrific working with him through this pandemic. He's been a great partner, and just thanks for all you do. We speak at least weekly, and I've just really appreciated his partnership throughout this. I'll give a quick update as to what's happening within UC Health as we speak. Right now, we have 23 patients that have tested positive for COVID-19 between Poudre Valley Hospital, Medical Center of the Rockies, and the Greeley facility, with 13 of those patients being in our intensive care unit. So to think that we are in the clear as it relates to hospitalizations, I think is we're not quite there, but we have seen a steady decline in these numbers throughout our entire health system, which has been great to see. As it relates to vaccine distribution, so Poudre Valley Medical Center of the Rockies and the Greeley Hospital have been primary distribution sites. As a UC Health system throughout the state, we have been able to administer, as of this morning, 612,597 doses of the COVID-19 vaccine, of which 318,000 were first doses and 294,000 were the second doses. And so we want to continue to get this vaccine out. We have seen a large decline in people registering to get the vaccine, and I think over the last 2 weeks we have seen kind of a complete shift from having more demand than supply to having more supply than demand. And so we are going to have to get creative as to how we get this vaccine in arms. And I know Tom's going to touch upon that, and completely open for any thoughts or ideas that you all may have as well. If you want to email me, my email address is kevin.unger@uchealth.org. And we are looking at ways that we can get shots in arms. We know for sure that if you are vaccinated, you're 93% less likely to contract COVID-19, which is a big deal. As of last week, we are now also vaccinating individuals that are 12 years and older. And so if you have younger kids that are looking to get the Pfizer vaccine, you can actually walk into Poudre Valley Medical Center of the Rockies, the Greeley Hospital, and get them vaccinated. Also Walgreens and the county, I'm sure Tom's going to talk a little bit about their efforts to get the vaccine out as well. but you do not need an appointment at this point. So you can walk in and actually get the vaccine. We are we have the Pfizer vaccine, which is what is being recommended and has received emergency use authorization for the 12 plus population at both Poudre Valley and at Medical Center of the Rockies and the Greeley facility. And so we are willing to look at new and improved ways to get the vaccine out. And as I said, if you have any thoughts or ideas, please let us know. What we're seeing is mostly the variant is kind of people are testing positive. Since February, really, it's been a large number of patients that are contracting these new variants, of which the vaccine is also proven to protect you against those variants. When I'm looking, and I know Tom's going to get into much more detail around this, but there is no question that the higher the percentage that a county is vaccinated, the lower rates of COVID that they are experiencing. And so this vaccine is, it's a great vaccine. I know I'm starting to hear rumors about infertility issues and this and that has been completely unproven. And so a really good place to get kind of vaccine data and COVID-19 data is the UC Health website. If you have kids and you want to do some research as to whether you should have your 12 plus year old children vaccinated, the Children's Hospital website has tremendous information about it as well. And of course, right now, our primary goal is to get shots in arms. And so if you have thoughts or ideas on how we could get creative doing this, because I do believe we have seen those that want to get vaccinated are pretty much vaccinated at this point, and we're going to have to really dig deep and get creative to get a larger population vaccinated at this point. And with that, Ann, I'll turn it back to you.
Excellent. Thank you so much, Kevin. We appreciate you joining us today, sharing a few insights as well as opening the door for new creative ideas. Really powerful, and we appreciate it tremendously. With that, we're going to switch over to our main event, which is Tom Gonzales, our Director of Public Health here in Larimer County. Tom's been an incredible leader for us throughout this incredible crisis, and we're fortunate to have him providing guidance and leadership to all of us. So welcome, Tom Gonzales. Thrilled to have you.
Thank you, Ann and Mindy and the Chambers. I appreciate setting this up. And Kevin Unger, thank you. You've been a partner in all of this. It's very difficult times, and what heroes you have in your hospitals. I appreciate all the work you're continuing to do to save lives. Members, before I jump in, I just want to talk about what a difficult 14 and a half months. And we look at how it impacts everyone in some way or another, but definitely our businesses. And we recognize that and the sacrifices every one of you made. You saved lives. I believe it. I know it. Our case rate is one of the lowest of the top large, more populated counties in Colorado. We had been through the pandemic. We've lost 250 souls, but when you look at other comparable counties and their case rates, they lost a lot more people because it was the sacrifices you made. And I know it wasn't easy. And I know at times it was very, very difficult. But there's more. There's a light at this end of the tunnel. As Kevin said, we're not all the way through the tunnel, but boy, yeah, that light is getting brighter, and it's exciting days. We'll talk a little bit about the metrics, and we'll dive in how vaccines are making a difference, and then what is next steps on the great news you heard this weekend regarding the lessening of the public health orders. But before I dive in, I do have two of our very talented staff here, Dr. Jared Olson, our epidemiologist, who has been incredible throughout the pandemic, giving us all the data and helping guide decisions based upon science and the data. And then Corey Wilford, who is our Office of Communications. So does all the communications and outreach with her joint information team. So let's dive into the data. As you see, we've made some changes, updates to our dashboard to reflect the changes with vaccines and the ever evolving COVID-19. Really what we're looking at is 4 metric areas. That's our 7-day case rate, our 7-day test positivity, COVID patients in the hospital. You heard Kevin give an update. I'm doing the math in my head with Banner. This number is probably going to go down, and that's exciting. We'd like to see that number down here in the green. 40, we've been at this high plateau for hospitalizations. It would be much, much worse 2 weeks ago if we didn't have vaccines. We'll talk more about that. And then our ICU census and utilization, that goes up and down, and Kevin can talk a lot more about it. Recently, we've had a lot of non-COVID-19 people in the ICU. It's been trauma, accidents, car accidents, falling accidents, those kind of things. Kevin calls it the trauma season, which I had never heard of before. But those are the metrics we look at. This right here will go away. We no longer have a state or Larimer County dial. We'll talk more about that. We base our risk based upon these 4 metrics. These 2 have been going down. In fact, our 7-day case rates went down 40% in the last 2 weeks. And we'll talk more about that. Our 7-day test positivity is now below 3% or 3% or less, which is very exciting. That's a good tell sign. We've always seen when case rates going down, normally our hospitalizations go down, and then less impact on the ICU. You can see the graphs here. We're really close to the old dial in blue. We made a little dip here in March, came back up. We'll talk why about that. But because some good news here, very, very good news. Here's that again. And we're going to talk about what happened here this wave. Dr. Olson believes that's the B116. That was the UK variant. When it came right into the state of Colorado, we had this uptick. We're going to compare it to vaccines, and now it's just dropping off the table. And that's all due to our work with vaccinations. But here we are with this hospitalizations. It's just high plateau, 38 to 40. We were up one time around 44. But when you talk to Margot, Carson Over Banner, and Kevin Unger, it's about 95% of our people suffering in the hospitals with COVID-19 are unvaccinated. They're unvaccinated. We only had a couple breakthroughs on the vaccine. So you get vaccinated, you have a 95% chance of not going to the hospital. So this is a preventable disease now. It's what we consider preventable, and we can prevent it through vaccinations and education. So that's the next move here. And we're going to talk about, I think the governor did a good job. Masks, they're 50% when you're there. And that was good 6 months ago. But now it's vaccinations. Let's get vaccinated. You don't have to wear a mask. If you're fully vaccinated, you don't have to get quarantined anymore. You don't have to alter your life based upon this darn virus. So vaccinations are really our ticket out of this pandemic, and they're slowly getting us there. Jared, why don't you go over this slide for me? Because Dr. Olson does a much better job than I can. So Dr. Jared Olson, our epidemiologist, would you go over this slide for us?
Sure, happy to. So the blue area filled in is the growing number of vaccinations, first doses to folks in our county. So you can see right up here, it's just over 50% of our total population that is now has at least 1 dose. At the same time, you can see our case rate over here. This is the red line. This is the 14-day case rate. It's a little smoother than the 7-day case rate, but the same overall, pretty much the same metric. So you can see we're coming down from our 3rd wave in the winter through December, January. Of course, there were ramifications, our hospital system that lasted well beyond that time frame, but kind of hitting this nadir here in March. And then we have a pretty steep upclimb from there. That was associated, or it was actually pretty similar to October 2020. And this is also the same time that B117 was not just showing up in our county, but was becoming the most prevalent strain of COVID-19. And so we have this peak here, and this particular peak could have been much, much worse if we had not had this high level of vaccination, kind of buffering against or mitigating a lot of the larger harms. And now you can see we've sort of turned this corner and are coming down, right? So B117 is well established. It's by my estimation, by the state's estimation, the most dominant variant here. And now continued vaccination is continuing to push that a little bit lower.
Thank you, Jared. And with that graph, Jared kind of just showed us the same for the United States. Here's the United States daily cases came down just a little bit of an uptick. We were hit by the B117 a little harder than others, but as the country gets vaccinated, cases are going down. You probably heard it on NPR. It's fairly significant when you look at it as a total country. Now let's compare that to the United Kingdom. Look at here, they come down, but they already had B117. So they didn't have an uptick like we did. As soon as they got to, where here we're at, this 50%, look at this, folks, flat, down. And this is what we're wanting to do. We're watching the UK as well as Israel now. Israel, as soon as they got, hear about this 58, 51, this is total population. Look at that, they like fell off a table. So, and they're just down here getting 5 or 6 cases a day, and they're a fairly populated country, but they're up here in the 63, 64-ish total population. That's where we want to be. That's if we get there, this is where we're going to be. We're seeing it around the world, and the UK and Israel certainly demonstrating it. So same thing. It's just we'd love to. We'll be here if we continued our vaccination efforts. You look at our age groups, and Dr. Olson does a really good job here telling us when the various age groups were eligible for the vaccine. Now, certainly, if you were a healthcare provider, you could get it back in December as well. Or if you were a teacher, that was in March. So there's some variations to that. But for the most part, eligibility, you can see slowly when you get those doses, boom, down goes the case. Went up a little bit with the B117. These are unvaccinated people. Because you heard Kevin Unger say 93 to 95%, you're vaccinated, you don't get the, you don't show symptoms, you don't spread the virus. And we see here, there are other groups, they drop. As soon as this age group, 50, 59, plummeted. So we can just demonstrate it by age groups as that age groups got vaccinated and the overall population as well starts coming down. Now here's a really good visual when it comes to hospitalization. So last summer, autumn, hospitalizations did decline because it's a seasonal disease, because we're mainly outside. Respiratory droplets do airborne much longer indoors versus outdoors. But we saw that the older population still was in the hospital. There was a gap, but the older decline was much slower. Flip that with vaccinations. Look at this, we're way down here for hospitalization, and older declining faster. So Kevin's seen a lot less 80, 70 up people in the hospital than he was 5, 6 months ago. It's more younger. We lost a couple of souls last week, folks, to fairly young people that were not vaccinated. So it can be a deadly virus. It's preventable, again, the vaccine. And it's just so, I can show graph upon graph how the data supports it. Here's another one. You've got, it's one of my favorite graphs the state gives us, but you're seeing as counties, the state gets vaccinated, how the case rate goes. But look at Eagle County here. They're looking like Israel. So they're up over 60%. Look at their cases. They're on there about 20, 25%. Here's Larimer. We've been following the line. About 2 months ago, we were right here. So we just, as soon as we get vaccinated, we just keep coming down the line. Here's Boulder, Broomfield. So it's pretty apparent. The more your area is vaccinated, the less amount of cases or your case rate goes down. Same thing for hospitalizations. There's Eagle. We want to be like Eagle. They're doing a very, very fantastic job. I give a shout out to Heath Harmon. It's their public health director. He's doing a fantastic job in Eagle. We need to be there, and that's where we're going to be with our efforts with Drive to 65. Now, this graph is just really showing, you hear about hesitancy versus, I'm going to get the vaccine right now. And then there's people in between. I'm going to wait and see, or only if it's required. Well, this is what the Kaiser Foundation found, is that most were ready to run and go get it. And we saw that early on. Kevin and I, we didn't have enough vaccine to get in arms. We're now at the wait and see, going to the only if required. So we, when we go to many of our clinics, we've been doing on-the-job clinics. We were at a construction site. We were at a insulation company last week in Loveland. Vaccinated 20 of the workers. They all rolled their sleeves up, and we were asking why now. they say we work up from sun up and sundown. We don't have time to go find a clinic. Or they said, I didn't know it was free. I thought it cost something like anything in health with health. So we got to make sure we're getting out that this is a no cost vaccine. And we're not asking anything. All we need to know is your name and your birthday to just put you in the system. Other than that, you can go to PVH and we'll show you our clinics. You can go to Medical Center of the Rockies, Sunrise, Salud, anytime. But we're just seeing a small amount that say definitely not. It's actually more of our younger male whites that we're really seeing some more of the hesitancy. But the point here, Dr. Olson's making it, if we worry about this group, we'll get to Israel. So that's where we need to put our energy, are the ones that think this costs money, or it's, they don't know when they can go because they have kids and a family and a job. So we need to come to them. And that's what we're going to be doing. It just talks about, you heard Kevin say, the vaccines work very well against the mutant strains, and they do. It's just showing that the big 117, our mRNA, is definitely working against it. J&J and some of the other ones like the South African. So it's just showing that overall vaccines are very effective against the mutants and even the wild strand. So here's something to know is, when we talk about natural immunity, actually, Jared, would you talk about that? You just tell me before the meeting, you got COVID-19, maybe you tested positive. How long does your immunity last versus the vaccine? And why is the vaccine better?
Yeah, natural immunity has a little more variability to it, right? So it lasts 4 months, it may last 6 months, it may last 8 months. We think around the median is about 6 months for folks. But fundamentally, the vaccine is designed in order to provoke the most vigorous immune response possible, and the disease itself is not. So for the vast majority of people, if you have an mRNA vaccine or a Johnson & Johnson vaccine, your immune response to that will be more vigorous than if you'd simply had the disease itself, and it will last for a longer period of time. And it will also be more robust against variants. We've seen multiple series of outbreaks in some areas like Manaus, Brazil, in India, places like that, where variants have caused major upticks, not just because they are more transmissible, but also because folks who maybe have had it previously might be a little bit more susceptible. So the highest level of protection you can provide yourself or provide your family or your community is definitely through vaccination.
Thanks, Jared. Moving along, just vaccination. What an amazing effort. We have 19 providers here approved to give the COVID-19 vaccine. As of yesterday, 327,000 doses. UC Health been one of our biggest partners and providers in those efforts. Thank you, Kevin. Over 181,000 people now have had at least one dose. We're getting there, and then almost 160,000 of our population is fully vaccinated. We're getting there. It's increasing every day. We did the drive to 65. Appreciate Keep No Co-Open and the chamber's support with that. We're just kind of showing where age groups are 60 and up. Met it. Gosh, 50 and 59. We're close. Our 31 to 39-year-olds, they've always been running a little high. We think that's just due to eligibility of that group. We got some work with our 40, 49, 25 to 30, and then 12 and up now. I might change now that CSU, Colorado State University, is mandating that students and educators are vaccinated, returning back into fall. So we're going to be really working with Colorado State University and Front Range Community College to make sure we've got access to vaccines for their students and educators. But we're getting there. We're getting there. It's getting better every week. Real quick, guidance. I know I'm sure you guys are all, okay, Tom, what the heck? All this change it just happened overnight, it seemed like. There are currently no Larimer County public health orders in place related to COVID-19. None. We believe vaccines are the way to go now. No more of, I told you guys there would be a time in this pandemic we'd come to here. By golly, we did, and it's nice. It's exciting. There are currently statewide orders that they have to Coloradans have to adhere to, but they're pretty minor. You've heard the masking, and it's up to the business. We're encouraging those that are not vaccinated to still wear their mask, protect others. If you're fully vaccinated, 14 days after the second dose or 14 days after J&J, you don't have to wear a mask. We're going to give an incentive. You're done. You're done with this for the most part. And then we want to make sure the businesses understand that you can still require face coverings. That's our business call, but there are no orders for that. It's encouraged if they're not vaccinated. I'm going to continue to wear my mask, just the role I have, and just supporting businesses that are still requiring masks. I want to support you guys for whatever way you want to do it. And then we do have some restrictions in the state order. So our pre-K through 12, our schools still face coverings. The end of school is May 26th, so we're supporting them there. In our long-term care facilities, our congregate setting like the jail, a face coverage required in those settings. And then it's important to know the federal mask mandate is still in place. It has not been changed. So what does that mean? Riding our buses, they're in Loveland or Fort Collins, they get federal funds. So you have to wear a face covering there. The national park, you have to wear face coverings in the national park. So anything federal. Corey, did I miss anything where else federal comes in where you need to wear a face covering?
Nope, just the public transportation for
Okay.
unvaccinated or vaccinated.
Okay, so that means we're gonna have Taste of Fort Collins. We're gonna have those kind of things. The only one requirement right now to the end of the month is indoor. If you're gonna have more than 500 and it's a ticketed seated event, like we're gonna have a big band concert or something, you're supposed to submit a plan to us for review. Again, that's still the end of the month. So that's only restrictions that are in place. And we want to just talk about what's the benefits of COVID-19 vaccination? Fewer sick days for employees, because 95% that are vaccinated, they don't get sick, they don't spread it. More predictability and less disruption to workforce. Hey, if we get somebody positive in your business and we're doing contact tracing and all your staff are vaccinated, that's the end of that. We don't have to do anymore, and we aren't going to quarantine your people. So unless they're showing symptoms or something else is going on, but it's really rare. So those are some benefits. Increased reliability for planning by reducing risk of future restrictions. I think the more we get vaccinated, the more we can continue to keep having the activities that we so enjoy. More in-person work options. Oh boy, that's going to be nice, where we can have in-person meetings and so forth. I also think there's increased confidence in in-person shopping and attendance. We are getting some pushback that this is too soon. This is too early. So we want our consumers to feel confident in our approach. We did by showing you the graphs, because we're getting closer to United Kingdom and Israel, and like Eagle County every day. I think tourism component as well, the more we're vaccinated. So what does that mean? Well, for the health department, we've been doing large clinics like at Moby Arena, Atsalan, at some of our schools. The ranch is still continuing, but we are now transitioning to more of these little pop-up clinics with employers. And as Kevin said, if you have ideas, you shoot them our way and go to Corey Wilford. Corey, would you mind putting your contact in the chat? We want to hear everything. We've done a couple. We did a walk, bike, drive up to Odell Brewing Company, vaccinated 50 people. That was a lot of fun. We'll be at the Lyric on Friday. We've got, I think, 60 already signed up for that one. And that's going to be fun. Like I said, we've been at a construction site. We got about 25, 30 people vaccinated at 6:30 in the morning. We've gone to an insulation company. So whatever, if we want to get a couple businesses together, make it fun, let's do it. Our goal is to get people vaccinated so we can get to the ultimate goal of what Israel's doing. They're actually partying in Israel because they don't have any cases. Again, this is just demonstrating what Kevin was saying. Unvaccinated, they're almost 93% of all of our cases right now. Partially, even one shot, you're going to be doing a lot better place than with no shots. And when you're fully vaccinated, you're just a little minor blimp of cases within the county, state, and the United States. Real quick, everybody's asking me, herd immunity. What the heck does this mean? Let's take a second on this. Corey put this slide together. It's really visual. This color, not immunized, but still healthy. Yellow, you're immunized and healthy. and then red, not immunized, sick, and contagious. We say immunized. Jared talked about natural immunity and vaccinated. Well, here's where we were back in November when things went red for us. 2 people, and you're in a large group, just about everybody got sick. Maybe a couple didn't. Now here's about where we're at 55%. You know, you see you have a few red. Yeah, you got more yellow now. They're blocking the ones that aren't immunized or they don't have any immunity. So we're protecting them, herd immunity. We're probably like right in here, Jared's estimating, where when we get to like Israel, this is what happens. Nobody gets sick because we have all the blockers, even though there's a few not immunized. Not everybody has to get immunized, but high enough to where they are protected and they don't get the virus. So that's what we're talking about, herd immunity. And we're slowly working our way to here. Appreciate it. You've heard the drive to 65. We're at 61.1% today, 16 plus. Now that we got 12-year-olds, we didn't change the goalposts on us, but we're adding about 1% every 3 days, Jared, I think so we want to just to continue to get up to 65. We think that's going to make a change. Jared, how many people is that 61 to 65% we need to get?
So that's about 12,000, 13,000 folks left.
All right, let's get, wouldn't that be great to get them by May 25th? Let's get all 13,000 of them. Lastly, just you have questions, please call our Joint Information Center. Corey and her team are awesome. They'll answer your phone call, text, email. If you have somebody says, hey, I'd like to get vaccinated, here's the website. We've got some information on vaccine and confidence, as well as where are all the various clinics at in the county where you can sign up for. With that, I'll turn it back to Ann.
Thanks so much, Tom. So we had a number of questions that have popped up in the chat. We've taken care of several of them in your comments, but let's let me scroll here and make sure that we have them all. So we did have a question about vaccine rate by race and ethnicity and what the county's been doing to address disparities. Can you talk a little bit about that? I did put in the drive to65.org that'll take people to that tracker, but comments you'd like to share there?
Yeah, I'll turn this over to Dr. Olson. Dr. Olson has been doing census tract work looking at white that have been vaccinated, white non-Latinx and Latinx. Jared, go over at some of the work that you're doing, which then is translated into our equity outreach work.
Sure. So about 12% of our population in Larimer County is Hispanic, all races. And that has been, as far as race and ethnicity, the main focus and the group that has needed the most help to kind of close that inequity and that disparity in vaccination. So we're working in multiple dimensions right now. So we're trying to think about times of day, dimensions of access. So where can we go to meet people where they are, such as Tom mentioned, the construction site. We also have a health equity coordinator who's been working with some of our local Hispanic and Latinx businesses in order to set up vaccination clinics on site, both for staff and customers, and continue to meet people at places that they're comfortable being vaccinated. He also hosts Sergio Torres. He also hosts Charlas once a week, so online discussions. We have relationships with outreach organizations that are doing door-to-door, right? We know that internet sign-up, internet access can be a barrier for folks. So now that we can continue to push walk-ins as well as registrations, we're continuing to pursue that. And we are seeing the proportional gap close. It used to be as high as 5 to 1. You were 5 times more likely to be vaccinated in Larimer County if you were a white non-Latinx resident compared to a Latinx resident. And now that number is below 3. So we still have more work to do in order to close that vaccination gap, but it is closing proportionally. And that's just something we have kind of our long-term sights on, and we'll continue to find areas where folks are under vaccinated, either where they live or through business and work opportunities. And certainly any businesses that are outreaching to that particular community or work with that community, we'd love to hear from you as well.
Excellent. Thank you so much, Dr. Olson. And you shared these comments, Tom, but let's reinforce them as far as what kinds of restrictions are in place for business, but especially for restaurants relative to masks, spacings, etc. And well, let's start there. Just to reinforce where we're at.
Yes, for restaurants, and well, I tell you, my heart goes out to every one of you. You had the hardest of it all. Very, very difficult on our restaurants. There's no restrictions. Your tables can be wherever you want them. You can have your bar open. The guidance says it's up. Unvaccinated people should wear a mask, but you guys can't go look for cards, and we don't want you doing that. So it's up to the business, but there is no regulations or orders or restrictions on our restaurants.
And if we keep vaccinating, then we stay in this space. What are your thoughts, Tom, on the chances of mandates coming back?
I felt great question. I failed to mention my concern as your public health director is October if we don't get to herd immunity on the slide we showed you. Because even looking at 1918, a year or 2.5 later, they had another in the fall. Now they didn't have vaccines for influenza in 1918, but there could be an increase, and it would be, I'm looking at Kevin, I'm always talking to him, where are we at with our hospitals? Our number one goal has always been able to prevent a surge on our hospitals, predominantly the ICU. We got this close in December, January, where we didn't have any beds in ICU, so we couldn't treat somebody that just had a heart attack or was in a car accident. So, but with vaccines, and we can keep going and driving, you see the correlation in the hospitals. So we got a lot of work this summer. We want to get up there, get to like Israel, then we won't have a 5th or 6th wave. I don't know where we're on. Come October, when we all start gathering back indoors and schools are in person and such. So I think it's all about vaccines.
Great, thanks, Tom. Another question came up as far as nuances relative to this lifting of restrictions. What's the best phone number? What's the best resource for business and government to use in order to maybe dive deeper if they have very specific questions?
Absolutely. Corey?
Hi, yeah, thanks. We have updated our business guidance page completely. So for those of you who are used to going there, it looks really different now, and it just really clearly outlines the local orders, there aren't any local orders, outlines some of the state requirements and recommendations. It links to all of those best practices for businesses that are now recommendations. And I'll stick that link into the chat. But you can also call our Joint Information Center. There's people there who answer the phones all day just about COVID things. And I'll put that number in there as well.
Great, thanks, Corey. So we'll drop those in the chat. We'll also make sure to send out an image that Tom shared earlier relative to really kind of all things COVID that's available on the Larimer County site. There was another question in the chat asking about PSD or schools that are still requiring masks. Can you talk a little bit about that, Tom, as far as why some of these larger spaces are still requiring masks and what we can do as business to support that?
Yeah, thank you for the question. It's in the governor's order, state public health order, that face coverings masks are only required in a few settings. One is pre-K through 12 schools, congregate living, i.e. long-term care or jail. So that's why our schools, I'll tell you, the schools, it's been very difficult, contact tracing and remote learning and all that. And I am an in-person person, believe in education soundly. So we only got a few more days. May 26th is last day for most of our schools. Just a week and a half more face coverings. I got 2 in middle school, and then we're done and with that part of it.
Great. Again, Corey has dropped into the chat, business guidance and facts, a link there. Do you have a question, Tom, about will we have a vaccine surge every 6 months? So will those of us that have been vaccinated need to start planning for that? Talk a little bit about that.
Yeah, and I'll take my stab at it, and then Kevin, I think, might even have more information on this one. Yeah, there's a booster being prepared by Pfizer and Moderna as well. It's going to be just like seasonal flu, is my understanding. Is that yours, Kevin?
That's what I'm hearing as well, Tom, but I don't have any specifics, and everything that I'm getting is hearsay, but there is a booster in the works.
Fantastic. Well, we are almost to our time today. We want to be very thoughtful of all of you. And certainly, please take advantage of the links that have been put into the chat. Again, we'll send them out to you directly so that you can have those. But thank you, all of you, for joining us today. We are thrilled to have so many folks that are interested in understanding this changing environment. And certainly we want to encourage everyone to continue to lean into some of those early keep NOCO open messages, like be kind, have a little bit of grace, be as thoughtful as you can as we all work our way through this landscape. Again, special thank you to Tom, to Kevin, as well as to Dr. Olson. We appreciate the fact that you were willing to share time today to make sure that our business community is as informed as possible. We hope that you will continue to be partners with us in our drive to 65. As Tom pointed out, vaccines are really the key to us returning to normal. And if you're able to and can, we encourage you to do so. And lean hard on our friends at the county that are willing to set up an on-site vaccine clinic for yourself, for your customers, for others. This is your opportunity to join and be a partner in taking us back to a new normal. So thank you again for joining us today. We appreciate it. We again recorded this session. We'll make it available on the chamber websites if you want to go back and review any of it. And again, take advantage of our friends over at the county. They're here to help us be successful and get us back to normal. Thank you all. Have a great day, and hopefully we'll see you all in person soon.